Hi, I'm Dr. David Green, CEO of Preferred Pain Center here in beautiful Phoenix and Scottsdale Metropolitan, Arizona. Today I'm out at Piestewa Peak, which is a gorgeous area with mountains, and they upkeep it great in central Phoenix. It has excellent hiking, picnicking, and there's no charge to get into this area. So on a day like today when it's in the 70s here in Phoenix and it's in the 30s and 40s and snowing in the rest of the country, how can you not spend a few hours out here? The topic for today is Mythbusters. I've done a couple series prior to this, so this is really the third video, but there's so many myths out there that I could go on with this series for weeks, so I probably will. So anyway, I want to discuss today 5 myths and whether they're true or they need to be debunked. The first one is whether or not extra weight causes back pain, and that is true. That is a myth that is true. A recent study out of Stony Brook University looked at 1 million patients and asked them about overweight, obesity, kind of classified them into their various height and weight and body mass index, and it showed a definitive link between obesity and overweight and increased pain. So if you have excess pounds, then you're going to have an increased incidence of low back pain. That's been shown time and time again. And when you do a study with statistical significance at over 1 million individuals, I think that myth can be debunked if you were thinking that excess weight didn't cause low back pain, okay? Now, the opposite though is, do thin individuals, are they precluded from having low back pain? And the answer is absolutely not, okay? So thin people can definitely develop low back pain, and the reason kind of dovetails into the third myth, which is that you have to have an injury to have low back pain. And that is just a myth as well. So whether you're thin or if you didn't have an injury, you can definitely have low back pain. Why? Genetics. You can thank your parents or your grandparents. If you're thin and you've never had an injury and you have a lot of low back pain, if you have degenerative disc disease, and you haven't been like a truck driver or had a car accident or been in big time sporting activities, you can still develop degenerative disc disease from just the luck of the draw, the bad luck of the draw, okay? Same thing with facet arthritis. There are individuals out there who've basically led a fairly sedentary life. They're not overweight, they get their exercise in 3 days a week with walking or whatnot. They're healthy, and they have horrible low back pain. Thank you, genetics. Thanks, mom and dad, basically, right? So you can have bad facet arthritis in your low back. You can have bad degenerative disc disease that causes pain. Just like I said, luck of the draw. So that is a myth that thin people don't get low back pain. You have to have an injury to have low back pain. So the next one is lifting heavy weights leads to low back pain. That is a myth. It's not that you're lifting heavy weights necessarily, it's that you're lifting heavy weights improperly. So there are proper ways to lift with ergonomics and whatnot. If you use your knees properly to lift heavy weight and your hips, as opposed to putting all the stress through your low back, then you're not going to necessarily increase the incidence of having a low back injury. So there is an overlap. I mean, lifting too heavy of a weight and you just too much for you, it might cause a low back injury. But just because you lift heavy weights doesn't mean you're going to get a low back problem. All right? So the last myth today is firm mattress. People think that if you sleep on a firm mattress and you have back pain, that it's going to help with your back pain. Well, there was a Spanish study that showed that's actually not true. It's the medium firmness of a mattress, not the stiff, that actually had those people had less back pain than if you had a firm mattress. So it doesn't mean just because you have back pain you have to go out and shop for a really hard, firm mattress. A medium mattress might be better, but that comes down to individual preference. So anyway, there you have it, Mythbusters Part 3. Check out our website at preferredpaincenter.com. There's a ton of information on our blog. We have a YouTube channel, which is what this is in. We also have animations on the website. We can help. We have chiropractors, pain doctors who can do medication management, interventional treatments, chiropractic, acupuncture, spinal decompression therapy, a lot of treatments that can be implemented together to help significantly. Success rates are well over 90% for helping with back pain, neck pain, arm, leg pain. You can call us today at 602-507-6550, or we're at preferredpaincenter.com. I'm Dr. David Green. Your pain stops here.